What's up guys? In this video, we are going to discuss pretty much everything there is to know about pulse oximeters. Are you ready? Let's go! So since you're here watching this video, you may be wondering what exactly is a pulse oximeter. A pulse oximeter is a device that is used to quickly and easily monitor a patient's oxygen saturation. This means that it can measure the level of oxygen within the blood, specifically in arterial blood, without using any invasive means. It is typically a small portable device that clips onto the finger and provides a reading within seconds. And in addition to monitoring oxygen saturation, the device provides a heart rate measurement as well. Arterial blood flows to parts of the body from the heart, fresh with oxygen, where it diffuses to the surrounding tissues and cells. And if there is a lack of oxygen in the blood, that means that your body tissues will not be oxygenated properly and can be hazardous to your health. This can be an indication of serious pulmonary issues. And that is why it's so important to use a pulse oximeter. Respiratory therapists, as well as other healthcare professionals, use these portable devices to constantly monitor their patients' oxygenation levels and their heart rate. And these vital sign readings help provide a better understanding of the patient's overall cardiopulmonary status. And in some cases, it is also recommended that patients with cardiopulmonary problems keep their very own pulse oximeter at home. So if that's you and you're looking to purchase a pulse oximeter, I put a few links down below to some of our top recommendations. So how exactly does a pulse oximeter work? Pulse oximeters work on a simple but brilliant principle. So basically, the pulse oximeter shines a light through your finger, and by doing so, it can measure the amount of oxygen that's in your blood. Blood absorbs light, and there's a distinct difference between the wavelengths that go through oxygenated and deoxygenated blood. The finger clip of the pulse oximeter consists of a transmitting light source that emits a broad spectrum of light. And on the other side, there's a receiver that measures how much light passes through the finger. The diode on the receiving end is capable of detecting the wavelength of light. The internal circuits and processing components of the pulse oximeter do some calculations as well. That is because the device has to compensate for ambient light, so for example the light in your room or from the sun. It also has to compensate for the size of the finger and for the absorbance of the rest of the tissues. The device has a reference curve that is saved into its memory, and it uses this as a way to calibrate incoming readings and to normalize them so that you can get an accurate reading. And this helps to increase the precision of the results that it provides. So what does a pulse oximeter measure? Now, as we mentioned before, a pulse oximeter measures the oxygen saturation in the blood, and it gives a heart rate measurement. And when I say it measures the saturation of oxygen in the blood, I'm of course talking about arterial blood. More precisely, it measures the amount of oxygen that is being carried by hemoglobin, and this reading is known as the SpO2. So the primary function of a pulse oximeter is to measure oxygen saturation, and by doing so, the heart rate is automatically calculated alongside of the percentage of oxygen. So heart rate and oxygen saturation complement one another, and doctors and respiratory therapists rely on these readings to know how to properly treat their patients. So if you already have a pulse oximeter, you may be wondering how to use it. The best part of pulse oximetry is that it's non-invasive. Back in the day, doctors had to draw blood from the patient and perform several tests in order to find out the percentage of oxygen saturation. Now we can get that reading in a matter of seconds by using a pulse oximeter. All you have to do is clip the device on the middle finger or on a toe or even on an earlobe. Some models are even surface probes that can attach to the patient's forehead or even their chest. And once the device is attached and turned on, it will provide you with the readings in a matter of seconds. But to get reliable, realistic readings, you should try to minimize the patient's movement as much as possible. And also, if you're using a fingertip pulse oximeter, make sure that you're not wearing any nail polish if you're using it on yourself, or if you're a medical professional, make sure that the patient does not have on any nail polish as well. And another question that I hear quite often is, which finger is best for a pulse oximeter? If you didn't know, accuracy is often the biggest concern when it comes to measuring oxygen saturation with a pulse oximeter. Some studies were performed and it actually showed that the middle finger of the right hand gives the best accuracy. And surprisingly, the thumb of the right hand came in second. This is a bit of a surprise for doctors, respiratory therapists, and medical practitioners because the same study showed that about 80% of healthcare workers tend to clip the pulse oximeter to the patient's index finger. But with that all said, the differences were negligible, and any finger, as long as the device is secure on the finger, should give you an accurate reading. But if you had to choose, you can always go with the middle finger of the right hand. And since you've made it this far, you may be wondering, can you purchase a pulse oximeter on Amazon? And the answer is yes, of course you can. Each of the pulse oximeters that we recommend can be purchased on Amazon at a pretty affordable rate. Just be sure to check with your doctor and the manufacturer to make sure that the device meets your needs, especially as a healthcare professional. But if you want to see the ones that we recommend, just check out the links down below in the description. And now let's talk about the risk of using a pulse oximeter. Now thankfully there aren't any risk or dangers of using a pulse oximeter. The biggest concern is making sure that the device is giving an accurate reading. This is especially true for doctors, respiratory therapists, and medical professionals. That is because if the pulse oximeter gives inaccurate results, that could lead to poor patient treatment and care. And yes, while technically it is true that there aren't any dangers in using the device itself, like you're not going to get shocked or anything, but there could be some very serious dangers if the results are not in the normal ranges, and that is what we are going to talk about next. What are the normal ranges for a pulse oximeter? Now we've already discussed what pulse oximeters measure and how they work. Now we need to talk about what the normal ranges are for heart rate and oxygen saturation. The normal range for heart rate is 60 to 100 beats per minute. The normal range for oxygen saturation is 95 to 100%. Now keep in mind, these are the normal values for an average adult. These ranges differ depending on your age. So that means your normal range could be different than someone else's normal range depending on how old you are. And while the normal range for oxygen saturation is 95 to 100%, the level isn't considered to be dangerously low until it drops below 90%. In such a case, that is referred to as hypoxemia, which means that there is an abnormally low level of oxygen in the blood. Hypoxemia is treated with supplemental oxygen. So if you are a regular user of a pulse oximeter at home and the results that you are getting are consistently falling outside of the normal ranges, it will probably be wise for you to consider seeing your doctor or seeking professional medical advice.